Well, it is time for Minding Money Matters, and Dorothea has on her green this week. Because I told you the last time you heard you could either wear green or not wear green. She's wearing green.
Wearing green.
Our finance expert, Dorothea Bernique, is back. Thank you for joining us.
Thanks for having me.
So good to see you. We're kind of switching gears a little bit as far as our topic. We're talking about credit reports, medical bills, specifically medical debt collection practices and nonprofit hospitals. Now, based on the research, what do we know so far?
Well, one thing that we do know is that about 58% of nonprofit of hospitals are nonprofit hospitals, which means they should have a financial policy which allows them to assist individuals with high medical bills. So part of the Bureau's findings is that many hospitals do not do a good job at advertising that.
I was going to ask you that. Do they even let you know about that?
Yes, yes. And so sometimes it's called charity care, and I have known it here in the local area to be a program whereby you would make application and they would determine if your situation dictates that they actually alleviate your medical bill. And many people do not know that that exists at some of our hospitals.
And when that happens, sometimes you'll receive a notice of collection.
Yes.
And so when someone receives that, what's the very first thing they should ask for?
Well, they should ask for that grand bill or the big bill so they can see everything itemized.
$500
exactly. Yes, exactly. You need to see everything itemized because just like our credit report, sometimes there's things on there that may not belong to us. Maybe there are services on there that you did not receive. So you want to look at that grand bill, to make sure that number one, all the services are yours. And then should it happen to go to collections or something like that, recognize that there are standard practices for collecting. They can't harass you. They can't call after certain hours. You have the ability to negotiate. You have the, exactly. And so those are things that you can do, but many times we just don't know what to do.
We just kind of accept it that that's the bill, that's how much I owe. I can't afford to pay for it right now, so I'm just going to set it aside.
Exactly. Exactly. And so it's just great to be mindful of fair bill or debt collection practices, what they can do, what they cannot do, and specifically for medical bills, take the opportunity to ask your hospital if they have this particular fund or ability for you to possibly get those bills just totally alleviated.
Okay, now is that a conversation you have on the front end or the back end after you get your bill?
Well, again, a lot of times it depends on your payment method. Sometimes even after insurance and all of those things have taken place, the financial status of an individual still means that they can't pay, so that you would do it afterwards, after all of that takes place, and just go and they would assess your financial situation and make a determination.
Okay, there we go. Thank you, Dorothea. Of course,
you're welcome.
Know what you can do and know that sometimes people do make mistakes and you'll get charged something that you shouldn't have been charged with.
Exactly.
All right, it's all workable. Thank you, Dorothea.
Thank you, Tessa.